Maria, I'd like to start with you. What are you and your staff seeing in your hospital right now?
Actually, we are faring a lot better than many facilities. We do have PUIs in our facility right now, no COVID positive patients at this time. We have had some, but none at this time. We are screening lots daily. We have associated with our hospital clinical critical access clinic, which have a clean and a dirty, and so we're sending all those patients there and screening through there.
Okay. What is it like caring for people who have active COVID infections?
They're sick people. And so just the whole process, you don't even think of the donning and the doffing and being so careful to ensure that you don't infect yourself or your workspace. All of that just takes time.
Okay. Jeff, up in the Four Corners, I would imagine you're seeing an influx of folks. What's happening at San Juan Regional Medical Center?
Yeah, thank you, Matt. We have seen really an uptick in our census just over the last 2 or 3 days for the first time since this whole COVID-19 response began. When the shutdown on non-essential healthcare services occurred, our volumes both on the inpatient side, outpatient surgery, and emergency department volumes really dropped sharply. But we're up to 140 inpatients today. We have currently, as of this morning, 32 COVID positive patients and 3 PUIs. And we've discharged 109 COVID patients who have recovered well enough to either go home or to their alternate care site.
What kind of stress does this put on the rest of the hospital operating? I know recently the governor allowed some procedures to continue or to resume, I should say, that aren't COVID related or aren't emergent. Just explain to me what your staffing situation looks like and your resources right now.
Well, the impact on the hospital is widespread. Our PPE is in very adequate shape, if not exceptional shape. We have a excellent emergency and disaster preparedness program, so we've maintained adequate supply there. The stress on the staff is very real. As Maria mentioned, that these patients are very sick, and to see patients come in and decompensate and pass away as quickly as some of these have is hard on professional caregivers whose calling is to heal and provide comfort to those who are sick. And to not be able to do that, and then often to see those patients have the type of isolation they do from their family members while they're recovering or even at the end of life is very, very difficult on everyone who's involved in that. So we've done a lot to try to support our teams through just social work availability, chaplain availability. We're standing up some additional emotional support services this week. And then the stress on the balance of the hospital is real as well, particularly from a financial component. We estimate that we're taking about a 40% per month reduction in our net revenue to date. So, that creates a lot of stress, as well as most hospitals typically operate on a very thin margin, and that loss of revenue is truly creating another sort of pain.
Maria, I'd like to ask you if your staffing levels have changed at all, if you've had staff have to stay out sick or stay out to care for people, family members who have COVID in their home.
We've only had one staff member that had to stay out, and actually she was a non-essential staff, and she got it from outside of our facility. So we've been fortunate that way. And the reason I say that is because we don't have much of a bench. I mean, we have no bench. We don't have much of a PRN pool, et cetera. So, the focus really is on keeping our staff healthy, keeping them protected, and, changing them out when we need to so that we can keep that flow. That's always a big concern.
Sure. your staff are people like the rest of us, and I'm sure they hear stories from colleagues. They watch the news to some extent. How are they doing with sort of what Jeff was talking about, the psychological aspect of this?
I think they have really risen to the occasion. We haven't had near the devastation that Farmington and Gallup McKinley has seen, knock on wood. We're right down the road. We're always fearing that shoe to drop. Ours has been less than theirs. But the one patient that did expire in our facility was very devastating for all the reasons that Mr. Burgess said, is that, the isolation, having to watch them, and it's not a pretty death by any means. And so, that's a real thing. And like he said, we've got to be supportive and here for them, and have resources for them also.
Sure. We've heard that with some patients, at least, it can go downhill quickly, especially with some of the younger patients who present in the emergency room, that the disease can progress rapidly. Have you seen that?
Yes, we have. Definitely, that is true. And that's what's so scary about it. You think one minute you're okay and you're getting better, and the next you're not. So that is and it's interesting in our county, and I'm not sure about in Farmington, but the age range, in a lot across New Mexico, across the nation, is higher for these people that don't fare well. But in our county, it's been the younger ones, the younger age range, like 40-ish.
Okay.
40
Jeff,
to
I know that you up in San Juan County have seen a number of cases, obviously, from managed care facilities or congregant settings, I think the health department calls them. What has that impact been to you and to your staff? And also, are you seeing what Maria is talking about, that there is an impact on some younger people too?
Well, as far as the congregate living settings, skilled nursing facilities and nursing homes, one of our physician leaders has been in contact with the medical directors at those facilities on a regular basis, and there are several that have a high number of their residents who are in fact COVID positive, and that's another difficult situation for the facility, for the individuals themselves, and of course their family members, as decisions are having to be made as to whether or not the residents would wish to come to the hospital or not, should their disease progress, or should they just pass away in place at their congregate living setting. And as you might expect, there are those that wish to stay in place, and those that wish to come to the hospital for care. The older patients, particularly any with a underlying comorbidity, as we've heard time and time again throughout any of the press and media outlets, tend to do very poorly with this disease and have poor outcomes. So that's a tough course of care for those patients. We have seen a number of younger patients, as well, as Maria mentioned, but our experience is more representative of what you see reported nationally, where the percentage of those that are hospitalized is certainly in the older age demographics for us, but we certainly have seen our share of younger patients, even 40 and younger as well.
And again, you've had a doctor in touch with some of these care facilities to sort of figure out what the best option is. Is that something new?
Well, I would say not really, but what's new is the frequency of the contact and the content of the contact. In the context of this COVID response, there's just increased communication with the medical directors at the various facilities, and we have one of our hospitalists who serves as a key liaison between us and the medical directors at those facilities.
Okay. Jeff, recently the governor announced that I believe through the federal government, the state is going to be providing higher Medicaid reimbursement rates. You talked earlier about the low margins oftentimes for hospital facilities. Will that help, and how soon will that get there? Do you know?
Well, we're very grateful for our state's leaders for advocating on our behalf via the waiver application that was approved by the federal level at CMS. Um, it's estimated that there's a $200 to $250 million monthly shortfall statewide on the part of the hospital. So this shot in the arm, although it's temporary through the length of the national emergency declaration, estimates to be about $66 million. It will certainly help. We haven't had a chance to model how much of that would be available to us. It's going to be on a per case basis, per patient basis. And the timing of that is still not certain at the moment. I believe the state is going to work to try to get that expedited as quickly as possible, though.
Okay. The Doctors Without Borders recently arrived on the Navajo Nation to assist them. Are you getting, Jeff, spillover, so to speak, from the Navajo Nation, whether it's IHS or from some of these facilities that Doctors Without Borders is setting up?
Well, certainly, and not really tied to the Doctors Without Borders, but we've taken transfers from Northern Navajo Medical Center in Shiprock, as well as Rehoboth McKinley and Gallup Indian Medical Center down in Gallup, as well as residents from the nation have found their way directly to our hospital. So, being essentially adjacent to the Navajo Nation, we certainly have cared for many Native American residents that live on the Navajo Nation, or just individuals of Native American descent that might live in town.
Okay. Maria, you're down in Grants, and of course, anyone who's been looking at the news has seen the actions that the mayor down there took. I'm one of those folks who's really anxious to get things opened up. From your perspective, does it feel to you like it's time to sort of maybe start loosening any of these restrictions, or would you like to see them stay in place a little bit longer just for the public health part?
For public health, I think we need to keep those in place a little bit longer. Just with them closing down Gallup, the busyness of Grants was markedly increased. Just in the last 2 weeks, we doubled in our numbers where we were 2 weeks ago, less than 2 weeks ago, we've doubled. We're starting to see more in our clinics, patients coming from Pruitt, Crown Point, et cetera, that we're testing in our clinics and stuff. So, and they're still on the rise, and so is, our 3 counties, McKinley, Cibola, and San Juan. So until we see that somewhat controlled, I mean, we could be in the same situation as Gallup if we get too loose.
Jeff, same question for you.
It's a great question, Matt. First and foremost, I can't begin to really appreciate and feel the pain of the small business owner throughout this. This is not only a clinical disaster, but it's truly an economic and financial disaster for our state, and particularly for our county up here. My prayers go out to those folks who've been so economically damaged by this. The rest of the story, though, is, as Maria points out, is the clinical reality that we're dealing with and how easily this virus is transmitted. And what we know from dealing with past pandemics in our country's history is that we have to take that seriously. And, we've got to practice social distancing. We've got to practice proper hand hygiene, wearing masks, etc., to do everything we can to slow the growth of the virus spread. And we've got a ways to go here in San Juan County.
And Matt, I do think that there are a lot of local business owners, very smart business owners, that could do that but in the meantime, they should be getting ready for that. But in the meantime, we have to get control.